Using advanced functional MRI techniques, both in clinical practice and research, Dr. Brad Jabour and Medical Imaging Center of Southern California are constantly working on developing cutting-edge technology to assist patients from all over the world.
When I overdose, I'm not scared at all. It's a really nice feeling when I overdose.
I fear he is going to die. It's just a matter of time.
Joining us is Dr. Bradley Jabour. Now, he is the world's leading neuroradiologist with more than 20 years in practice. Now, he did his residency at Stanford University, his radiology fellowship at the University of Southern California and UCLA. He's an expert on the impact of drugs such as heroin on the brain. Now, Dr. Jabour has pioneered cutting-edge breakthroughs in imaging. And yesterday, I asked him to do a very sophisticated Fmri on JJ's brain at his facility, the Medical Imaging Center of Southern California in Santa Monica. Take a look.
I'm really nervous about today. I'm expecting to just find out what's going on with my brain and my whole body. And I just want to find out why I am the way I am. I'm really not sure what to expect.
Good morning, JJ. What we want to do is try and help you. We're going to be performing a functional MRI today.
I'm really nervous.
Don't be nervous. You're going to be inside a tunnel and it's going to make a lot of noise. Try not to move. Just relax. The key thing is to let your brain just wander. Now this is very dramatic, by the way. Okay, we are now finished. Let's get him out. You did a great job.
Thank you.
It wasn't that bad, was it? We've got some very good information.
Hope to find out tomorrow what's really going on with me and find out what I can do to fix it.
Well, Dr. Jabour, thank you for being here. I appreciate you being part of the show today. This is so important, and it is the reason that I agreed to do this. Tell us what an Fmri is. Everybody's heard of MRI. Tell us what an Fmri is.
So with functional magnetic resonance imaging, we now have a mechanism to see the thinking brain, to analyze the brain not just as a shape, but to actually have a window into how the brain is thinking.
Okay, so in other words, we're able to see what the brain looks like when it's performing certain functions, when it's doing certain things. We have an image up now where this is one of the images, a 3D image that you guys generate in this Star Wars technology you have, where you're basically showing the circuitry of the brain, the wiring of the brain. Let's take a look at the first image and see what we have found here. Now, what we're looking here is at JJ's brain scan. We're talking here about basically you see that his brain is actually shrinking inside the cavity, correct?
Yeah, the analogy is if you imagine a grape, a nice plump, healthy grape. It's got a nice smooth, maybe a little fold here or there, but when it becomes a raisin, it shrinks and develops multiple folds. So really, when you abuse your brain over a long period of time, the brain, just like a grape, will shrink back and you'll see more space between the skull and the brain itself. The white represents fluid, the cerebrospinal fluid, that becomes a bigger space when the brain shrinks.
Okay, so we're talking about these spaces here.
The thing about JJ's brain is it's very prominent in the frontotemporal area, the very important area for executive function, where you think and plan your life.
This is the most sophisticated part of the brain.
We have an indication that there's going to be some more abnormalities as we delve into the scan in more detail.
Okay, tell us what we're seeing here. We have JJ's brain on this side, a normal brain on the other side.
So if you think of the brain as a machine, this is a measure of the flow of blood to the brain. A normal brain in a right-handed person should have dominant activity on the left. Now, the red represents good function, more. Blue and black mean less. So between red and blue, you have orange and yellow, so there's this grade of activity. So you have good activity throughout the left brain in this normal person who's right-handed. You can see that in JJ, just immediately, that there's much less red activity. The engine is not working.
Let's take a look at this, which is the brain at rest.
When the patient's in that scanner and they're not thinking about anything, just letting their brain ruminate, you should only have, in the normal population, the green represents what the footprint of the default mode network would be in a normal population. In JJ, he has multiple default mode networks instead of just one, and each of those networks is hyper-connected, which is an indication that he has disrupted brain networks. Mm-hmm. And this means that the computers in the brain, many different computers hooked to each other, the computers are just not talking to each other.
This indicates, because this yellow should be not visible, this should be smaller than what we have green, which means the default network is disrupted. His networking is not right. Let's go back to the image right before this. Here we see metabolically he is disrupted because he is not getting enough oxygen and other activity metabolically in the brain, particularly in the executive functions. And if we can go to the image right before, we can see that the brain is actually shrinking inside the cavity here.
Yes.
So the brain is shrinking, the metabolic activity in the brain is shut down, and the networking in the brain is disrupted. Okay, let's have a seat, because I have a very important question for you, and this is what you guys need to be really interested in. Is it too late?
So JJ is 29 years old, right? 27. So we know this, that in a young male, and I think young is in your 20s, if you have a dramatic and determined, prolonged program where you abstain from poisoning your brain, the neuroplasticity, the normal ability of the brain to regenerate, we know that that miracle can happen in terms of regenerating tissue. The networks are fragile. The networks have to be rebuilt, and that will take functioning in a very intensive program to re-establish the correct lifestyle habits and also mechanical functions of a productive life. Otherwise, those networks won't come back together again.
So if he stops this at this point, if he stops putting these toxic poisons in his brain, it can regenerate, and he can regain a substantial amount of this functioning.
You know, he's reaching the age where if he doesn't do something now, it becomes more difficult as you become a mature adult.
Yeah, the neuroplasticity is declining.
Yeah,
he needs to do it, and he needs to do it now.
Yes.
All right, now Susan wrote to me 9 times saying that she watches me every day and she knows that JJ needs to hear my words, but he's not the only one.
For more information about Medical Imaging Center of Southern California, go to www.micsc.com and learn about its MRI, CT, PET-CT, outpatient surgery, and women's imaging centers.